Senior Connections, a show about senior issues and events. A guide to active, independent living. With your hosts, Margie Toms and Janet Halliday.
Welcome to Senior Connections. I'm Janet Halliday, and we're going to be talking about a very important subject called driving rehabilitation. My guests today are Stephanie Scharf. She's a registered occupational therapist and
driving rehabilitation specialist.
And Mr. Jerry Poston. Jerry is a former patient and has gone through the program. And this program is at Palmetto Health, correct?
Yes.
How many programs are there in a state like this?
There are 3 others in addition to mine. There's one in Greenville at Rogers C. Peace Rehab, Myrtle Beach, Atlantic Physical Therapy, and the VA.
Okay. And who would benefit from this type of evaluation?
Any client who has a physical or cognitive disability. So the ultimate goal of the program is to try and keep people on the road driving safely as long as possible so that they can maintain their independence and adjust to their disability.
Okay. And you went through the program, correct?
Yes.
Now, did you do that out of choice or did you do that out of a doctor's recommendation?
Yes. I had a stroke early last year, and I went through a couple of months of rehabilitation and, of course, a lot of doctor's appointments, and my wife had to take me on each one of those, and she still works, and it was difficult for her to get off work each time to do it, but she did. Going through the program, it was a good situation.
So after you went through the program, did it kind of make you more confident in your ability to drive and continue to drive?
Absolutely. After the stroke and after rehab, I thought I could drive. I thought I was able to do it, but there was some question in my mind, and I thought that driving is it is really a great privilege, and it also carries with it an awesome responsibility. And weighing those, I thought, well, maybe I should make sure. And I talked around to some of the people, and I talked to my primary care physician, and she said, well, I don't want you to drive right now, but there is a program that I'd like for you to participate in. And the person that does it is right down the hall from our office. So she recommended and
gave
I
you a
agreed
referral.
wholeheartedly. Yes.
I see. Okay, and we're going to talk about that. Now, what ages do you evaluate?
Any age group. Although I work in geriatric research, I see people of any age. I try not to see brand new drivers, newly licensed drivers at this point. At a later future date, I plan to see new drivers. I want to point out that it's not a matter of age, it's a matter of performance for the person.
Right, right. Now, how long does the evaluation usually take?
It's a 2-part evaluation. So it's 2 days. The first part is in the clinic, and it's about 2 hours long. I'm looking at physical, cognitive, and visual abilities to operate a vehicle. So I'm not only looking at range of motion, strength, I'm looking at visual acuity, visual processing speed, depth perception, cognitive skills, long-term memory, short-term memory, judgment, executive function skills for thinking. The second portion of the evaluation is an on-the-road assessment where we actually use our car. We have to use our car for state law because we have a brake on the passenger side. And it's roughly an hour to an hour and a half long. We start out residential, then we move to moderate traffic to increase the environment dynamics. And then if the person was an interstate driver, we go on the interstate.
Okay. Was the evaluation what you expected it to be?
Yes, some of it was. I expected for my reflex time and things of that, vision, and a lot of other things to be tested, but some of the things like multitasking, I did not expect in it, and I think that was very good. Driving is a thing where you're doing several things at almost the same time.
Oh, and my husband always says we can't do that. But we're going to take our first break, and be sure and check out our sponsors. If you have need for their services, give them a call, and we'll be right back to talk about more on driving rehabilitation.
You may have seen actors on TV talking about reverse mortgages. Well, I am not an actor. I am Larry Reed, and I live in the Midlands. For 7 years, I have been meeting face-to-face with older adults throughout the Carolinas and Georgia, supporting them to safely access their home equity with the federally insured reverse mortgage. So please call me. I'll help you understand the program, and then you can decide if a reverse mortgage is right for you.
I live alone and rarely have visitors. So when I slipped and fell in the kitchen last month and couldn't get to a phone, I knew I was in trouble.
Help!
I could barely move.
Help!
I tried calling for help, but no one could hear me. As I lay there, I couldn't help but think of my kids and grandkids having to go on without me. I was terrified. It took 8 hours for my neighbor to find me. It could have been the end of me. That's when I knew I needed Life Alert. With just one press of this button, I'm connected to the Life Alert Center, where I can get the help I need, even when I cannot reach a phone. With Life Alert, I'm never alone.
We save a life from a catastrophe every 11 minutes. For a free Life Alert brochure, call 800-485-5621. That's 800-485-5621. Call 800-485-5621 today.
Don't compromise, mobilize with All Medical.
Enhance your mobility and independence with a van from All Medical. Choose from a Dodge Caravan or a Honda Odyssey and customize it for your needs. Whether you're slightly ambulatory or in a wheelchair, you'll enjoy knowing you can get around town whenever you want. You depend on All Medical to provide services and products to fit your lifestyle. Now call on All Medical to take you that extra mile.
Don't compromise, mobilize with All Medical.
At Heartstrings Hospice, we are here to help. Each patient has a team dedicated to providing emotional, medical, and spiritual support. At Heartstrings Hospice, we will ensure the time that you have together will allow you to be just your son and you to be just your daughter, because you shouldn't have to be anything else. At Heartstrings Hospice, we are here to help.
At Crescent Construction, we know your home is one of your most valuable assets.
We specialize in roofing and remodeling projects. Leaks, storm damage, and age are all signs you may need to repair or even replace your roof. We perform a 20-point certified roof inspection when most contractors do not. We can better identify issues that may result in further and more costly damage.
A roofing assessment is free, so call us at 781-1900.
We guarantee our team is professional, clean, and dedicated to your satisfaction. So call us today.
Are you or someone you love having difficulty getting into the tub for a bath or unable to stand in the shower? Call Comar Products today for help with safe, comfortable, independent bathing solutions. We specialize in products like walk-in tubs and roll-in showers. Our walk-in tubs feature hydrotherapy technology, so your bath is always warm and may even increase blood flow circulation and reduce swelling. Call Comar today to schedule your showroom appointment or visit us at 1759 Airport Boulevard in Casey.
Welcome back to Senior Connections. We're talking about driving rehabilitation with Stephanie Scharf, the occupational therapist, and a participant in the rehab program, Mr. Jerry Poston. And before we went to break, Jerry was telling us about, I had asked him if it met his expectations, and you were telling us about, I guess, he had a lot of fun.
He did.
Yeah.
When he finished the end of clinic evaluation, his first words were, "This was fun."
Now, why did you think it was so fun?
It's a serious business, and they made me really comfortable as I was going through it, and it was fun. Some of the things that we did was fun things.
So she's entertaining too, huh? I see. What part of the evaluation, though, did you think was the most difficult? I know you were saying multitasking. Was it driving or actually in the initial evaluation?
I thought initially that probably the driving was going to be the most difficult. But like Stephanie says, we're on the road for more than an hour. It put me at ease when I got behind the wheel, and it was a pleasant day, and we had a pleasant drive, and fortunately I was able to do the things that I needed to do to get through the program.
Were you more concerned about your physical limitations?
I was, I wanted to know that my reflex time was going to be good, where I could stop the vehicle if I needed to. I also wanted to know that can I keep up with the speedometer, and can I make sure I'm in the right lane to turn, and am I aware of what's going on beside me and the other vehicles and so forth.
Now, when you talk about speed, were you afraid you were going under speed or over speed?
Well, I thought when I first did the testing that I'd probably go too slow.
I see.
But I thought initially that I was ready, and it worked out well.
Okay. Now, how do people learn about this program, Stephanie?
I've actually marketed to the local physicians. I have sent referrals and brochures, but I do presentations to different organizations, churches, even other healthcare professionals, and then I have found that word of mouth has also been a great asset.
Now, I know one of the biggest concerns, nobody wants to lose the ability to drive, because once you do that, you become isolated and you lose part of your independence. But you also do this program and look at ways of doing modifications. Is that right?
Yes. So if someone they have a lot of left-hand turns, unprotected left-hand turns in their route, and we find that that's not necessarily the safest way for them to go. We've helped them plan different routes to go to the same destinations, but it may be a little out of their way, but maybe they have protected turns or right-hand turns. They can make several rights to make a left turn. Also, it may be something simple like adaptive equipment. Something that's low-tech, a little more costly would be hand controls, or it may just be something to help them get in and out of the car like a handy bar.
I see. So once you've done your evaluation, then what happens? Does it go back to the doctor? Does it go to the Department of Transport? What happens?
So it goes back to the physician. So I send both the in the clinic and the behind the wheel referral, the evaluation to the physician. And the physician, our recommendations are on the referral, on the behind the wheel assessment. So once the physician sees that, then the patient meets with the physician or either calls them to make sure that they have clearance, or if the physician agrees with the recommendations that we've made.
Okay. All right, and we're going to go to break again. And if you have need for the services our sponsors provide, give them a call. And also check out our website, seniorconnectionssc.com, and we'll be right back.
You may have seen actors on TV talking about reverse mortgages. Well, I am not an actor. I am Larry Reed and I live in the Midlands. I'll help you understand the program, and then you can decide if a reverse mortgage is right for you.
At Crescent Construction, we know your home is one of your most valuable assets.
We specialize in roofing and remodeling projects. Leaks, storm damage, and age are all signs you may need to repair or even replace your roof. We perform a 20-point certified roof inspection when most contractors do not. We can better identify issues that may result in further and more costly damage.
A roofing assessment is free, so call us at 781-1900.
We guarantee our team is professional, clean, and dedicated to your satisfaction. So call us today.
Don't compromise, mobilize with All Medical.
Enhance your mobility and independence with a van from All Medical. Choose from a Dodge Caravan or a Honda Odyssey and customize it for your needs. Whether you're slightly ambulatory or in a wheelchair, you'll enjoy knowing you can get around town whenever you want. You depend on All Medical to provide services and products to fit your lifestyle. Now call on All Medical to take you that extra mile.
Don't compromise, mobilize with All Medical.
I'm calling North Point.
We'll be right there. Call 788-8081 when your system.
This does not work.
I can fix that.
We'll be right there. Call 788-8081 when your system needs repair. Think North Point Heating and Air.
I
I live alone, so when I slipped and fell in the kitchen last month and couldn't get to a phone, that's when I knew I needed Life Alert. With just one press of this button, I'm connected to the Life Alert Center, where I can get the help I need, even when I cannot reach a phone. With Life Alert, I'm never alone.
For a free Life Alert brochure, call 800-485-5621. That's 800-485-5621. Call 800-485-5621 today.
As large corporations continue to take over local businesses, Carnegie and Mosley Funeral Home is still family-owned and independent. They believe that bigger doesn't mean better, and people always come before profits. That trust is earned, not bought. The Carnegie and Mosley family has been serving families since 1884. Carnegie and Mosley Funeral Home, they are your neighbors, and you'll appreciate the difference.
You may have seen actors on TV talking about reverse mortgages. Well, I am not an actor. I am Larry Reed and I live in the Midlands. I'll help you understand the program and then you can decide if a reverse mortgage is right for you.
Welcome back to Senior Connections. We're talking with Stephanie Scharf, occupational therapist, and Jerry Poston, who has completed an evaluation for driving rehab. And I wanted to ask you, what is the cost for this? Is it covered by insurance, or how does that work?
Generally, the in-the-clinic evaluation is covered by insurance as an occupational therapy evaluation, as long as that client's insurance covers occupational therapy services. And I do try to find that out for the client before they come to see me to make sure that it's covered. The car assessment is out of pocket. Unfortunately, that's considered a luxury through insurance companies driving, so it's not covered. It's $120 an hour, and the average road evaluation is an hour to an hour and a half long.
And did you think it was a good value?
It's excellent value for the peace of mind and whatever that you get from knowing that you are able to do it again, yes.
Right. Now, is there any kind of credit to your insurance if you've gone through this program? I mean, do they give you like points or any kind of deduction on your insurance?
No, we're not set up like that.
But they should be.
It's a little different since it's a medical background and they're coming for a medical evaluation. So it's not the same as training for safety tips or when you go to a class to learn any new rules or regulations.
I see. Have you recommended this program to any of your friends?
I have not had anyone in the same situation, but I would certainly recommend it if somebody is considering doing this. There must be some question in their mind as to whether they are totally able to drive, and I think that it would certainly be to the benefit to go to the program and get the peace of mind that comes along with knowing that you do have the ability to drive.
I know that I do a support group for spouses of dementia, and one of the things that I always say when we're talking about should you or when is it time to take the keys away, would you put your grandchildren in the back seat with that individual? If they won't put their grandchildren in the back seat, they probably shouldn't be driving. But it's amazing how many people really continue to drive and probably shouldn't. Now, I know, Stephanie, you had brought some wonderful books. One is called We Need to Talk, and we will have the link and also the addresses up there on the screen. And At the Crossroads, this is basically about Alzheimer's dementia.
At the Crossroads is, yes. And how to help the family realize if there are some signs or warning signs where the person's having trouble driving, and maybe to discuss driving cessation. Whereas As We Need to Talk is for family members who have aging parents or caregivers who know someone that's aging. It's not necessarily to stop driving, but to start the conversation, because the whole key is to start that conversation early.
Exactly.
With everybody.
For everybody, because you have... Now, I think you told me you live out in Lexington.
That's correct.
So there's really no services out there for someone who doesn't drive.
You don't have bus services, no.
So basically, if they told you you couldn't drive, Were you looking into other options?
I had thought about having someone to come and drive me, a friend or somebody that's close. And of course, that you get into expenses even if it's a friend, because you want to compensate them for doing so much of that. And I had thought about that, but fortunately, through the time that my wife was able to take me to all appointments. But had she not been able to, we would have run into considerable expense in doing that.
Okay. And we're going to take another break, and be sure and check out our website, seniorconnectionssc.com. We have events and also other links on the website and past episodes that you might want to check out, and we'll be right back.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
Woodash is having a mattress sale. Why pay thousands of dollars for a Visco memory foam mattress when you can get a complete two-piece queen set at Woodash for $3.99? This quality mattress layered with Visco memory foam features a cool, comfortable quilted top for a comfortable, cool sleep every night. Highly resilient, highly durable, and best of all, at a discount price starting at just $3.99 for the two-piece queen set. For the lowest discount prices featuring Visco memory foam mattresses starting at $3.99, shop Woodash today. Woodash, located in the heart of the Vista, 919 Gervais.
At Crescent Construction, we know your home is one of your most valuable assets.
We specialize in roofing and remodeling projects. Leaks, storm damage, and age are all signs you may need to repair or even replace your roof. We perform a 20-point certified roof inspection when most contractors do not. We can better identify issues that may result in further and more costly damage.
A roofing assessment is free, so call us at 781-1900.
We guarantee our team is professional, clean, and dedicated to your satisfaction. So call us today.
Hi, my name's CJ. A few years ago, my father became seriously ill. I did what I could do before he passed, but it took its toll. I lost my job, my house. I'm getting back on my feet, but I don't know when there'll be food on the table. How'd I do, CJ?
We could be twins.
Well, cousins, maybe.
Play a role in ending hunger. Visit feedingamerica.org/hunger and find your local food bank.
I'm calling North Point.
We'll be right there. Call 788-8081 when your system.
This does not work.
I can fix that.
We'll be right there. Call 788-8081 when your system needs repair. Think North Point Heating and Air.
Attention, catheter patients on Medicare.
I use catheters, and if you do too, please listen carefully. There is a new catheter that hurts less, and you can get a free sample by calling this number now.
Pain and urinary tract infections have been avoided by many of my patients. These new disposable catheters hurt less. It's an incredible new design that reduces pain. The eyelets are polished, so they glide smoothly and effortlessly across your sensitive skin. Call now and get a free sample. Medicare and your insurance will pay for up to 200 of these catheters per month, all at little or no cost to you.
Call now for your free sample. It will arrive with a complete 90-day order, and if it doesn't reduce your pain, we'll pick them up for free.
Please call 1-800-394-8763. That's 1-800-394-8763. 1-800-394-8763.
Are you or someone you love having difficulty getting into the tub for a bath? Unable to stand in the shower? Call Comar Products, where we specialize in products like walk-in tubs and roll-in showers. Call for an appointment or visit us at 1759 Airport Boulevard in Casey.
Welcome back to Senior Connections. I'm talking with Stephanie Sharp. She is an occupational therapist from Palmetto Rehabilitation Driving School, and Jerry Poston. He is a former patient that has gone through the program. And Stephanie, we want to make sure that the audience understands how is it that they can get a referral?
I need a physician's referral. So sometimes I'll get a call from somebody who's interested, and I will help them get that referral from the physician.
Okay, and now that can be any physician, correct?
Any physician, yes.
Okay, so doesn't have to be a Palmetto Health physician.
No.
And it doesn't have to be internal medicine, family practice. So basically, an orthopedic surgeon could give the
That's correct.
recommendation.
Mhm.
Okay.
Psychiatry, it doesn't matter.
Okay, and then once you've gone through the program, what is the process if you need the adaptations again?
If someone comes through and they need adaptations for the car, what I do is we determine what they're going to need from the in-the-clinic evaluation. Then when we go out on the road, then we determine what type that they're going to need. So there's several different types of, let's say, hand controls or spinner knobs or different seating modifications. So we'll try the person in an empty parking lot, have them try the equipment. If that one doesn't work, we'll try another one just to figure out what piece works best. Then we start the training from there.
Now, the training is a separate program.
It is.
Okay. It
Yes.
doesn't actually come with this program.
The training is just offered on other days.
Okay.
So we do the evaluation on the initial road assessment day to determine the equipment type, and then we'll let that person know about how many hours of training that they're going to require before they're determined competent and safe to use the equipment. And then once they're determined competent and safe, then we send information to the DMV and to the physician and the vendor of choice so the equipment can be installed.
Now, if they don't pass the test or the evaluation, then what happens?
We try not to let that happen often, but it does happen, unfortunately. Not necessarily people with adaptive equipment, but people who come in for an evaluation. They have to sign paperwork saying it's okay for me to release information to the DMV and to the physician before we do the evaluation. Once I do the evaluation and we determine they're no longer safe, I let them know that I'm letting the DMV know and the physician. The DMV will send the patient a packet of paperwork in the mail, and that patient has to take that paperwork to the physician. The physician has the ultimate say. We only make the recommendations, but the physician will agree with our recommendations or not, and then they'll fill out the paperwork.
If you had not passed, were you prepared to give up your keys?
I think you really have to be prepared. There comes a time which is going to happen to all of us. We want to delay that as long as we possibly can. I feel like this program certainly helps do that. But,
Well, I admire you so much in taking that initial step and doing that, because this is one of the biggest complaints that I hear from families. They don't want to be the bad guy.
Exactly.
And we're going to end on that note. Thank you for being with us today. It certainly is a valuable program. We probably need about 6 of them to accommodate. But make sure that you pick up your copy of Senior Living Guide and check out our website at seniorconnectionssc.com. There are past episodes and events, and thanks for being with us today, and may God bless.